Hi, my name's Phil. I like talking about politics, and in this video I'd like to offer my usual thoughts on PMQs as Starmer questions Sunak's 5 new promises, especially drawing attention to what it seemed to miss out. Also worth noting, a little bit of drama, courtesy of James Cleverly, dropped a little bit of a clanger, and he wasn't even supposed to be giving answers. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel. So I'll leave the drama for the end because it involves language that YouTube doesn't appreciate early on. But for this video, I'm going to be mostly drawing out the main themes of Starmer's questions on Sunak's latest reset. I've lost count as to how many resets this is now, but almost all of the Labour leaders' questions were on the NHS and healthcare. That was the clear focus. But he made extremely good points in linking performance with both the plans for economic growth and Sunak's change in pledge priority. So let's first compare Sunak's pledges at the start of the year with the new ones this month. So the original were halving inflation, reducing national debt, growing the economy, reducing NHS waiting lists and stopping the boats. The new promises are reducing debt, cutting tax, securing energy, backing British businesses and world-class education. What happened to the NHS? Starmer was asking. Because if you were to group January's promises with the new ones this month, it was like in January there were 3 for the economy, 1 for healthcare and 1 for asylum. With the new ones, there are 2 for the economy, and one of those is a bit pushing it a bit, none for healthcare. Yet the economy and healthcare are the main concerns of voters. In fact, it's worth noting that none of the new promises relate to asylum either. It's like once Sunak had cast off the shackles of Braverman and her fixation, he no longer felt the need to prioritise culture wars. Because if you look at Sunak's new promises, none of them add fuel to the fire of the Tory culture wars at all. Which is healthy, you could say, until you realise that his promises are now focused on corporate greed. But Starmer was interested in healthcare today. He asked why Sunak had left the NHS out of his new promises. Sunak said that he'd put record money into the NHS, which is not true. He also claimed that he'd halved inflation and reduced debt. A half-truth and an outright lie. Sunak has not halved inflation. CPI inflation has halved, but without any government policies, any government intervention. And core inflation has nowhere near halved. As for reducing debt, debt is still going up. When he made this false claim, it was either earlier this week or last week, I can't remember, it was quite recent. The Institute for Fiscal Studies immediately called him out, saying, no, debt is still rising and it's not actually due to fall for years. Now, I could point out that Sunak could not even get past the first question without telling a verifiable lie. But he's been doing this for a while now. What I am dismayed at is that Sunak feels comfortable telling such an obvious lie when doing so is supposed to require your resignation. Because Sunak made this claim recently and was called out very publicly by the independent body who monitor debt. So there's no way that if someone was to say, they may well have said it by the time this video comes out. At point of order, Mr. Speaker, the Prime Minister seems to have been talking bollocks again. You know, then the Speaker would say, oh, I'm sure it was inadvertent. I'm sure he'll come along, correct the record and then not do so. But there's no way Sunak could claim that this was inadvertently misleading the House. Because he was told quite recently, no, it's still going up. So then you'll be saying, oh, so there's presumably going to be a privileges investigation into Sunak as there was for Johnson. No. And this is because the public were outraged at Johnson's behaviour, but not Sunak's. And it's a fine demonstration that we have no checks and balances on the abuse of power. People said, you know, the Privileges Committee investigation, oh, it shows that we have some standards after all. No, it didn't. Because otherwise the same standards would be applied to Sunak. We have no checks and balances on the abuses of power. We have illusions which sometimes manifest themselves when the public are paying attention. But that's what's required. That's the missing element. The public have to be really outraged before any of these like ethereal checks and balances become real, which is rare. But anyway, back to the questions. And after Starmer pointed out that the NHS seemed to have dropped off Sunak's radar, he then asked how workers can grow the economy if they have to wait a year for an operation. Now, this is a point I've made regularly myself, especially when calling out the, never mind cruelty, the stupidity of austerity. You know, we don't have public services to be nice. There are some people who go, you know, it's part of a civilised society to have this, that and the other, and it's okay, you can argue that. But there is always a cold, hard economic argument for having them and making them effective. Like with healthcare, the effective size of your workforce is reduced according to what proportion of it is ill or injured. If an illness or injury takes longer to be treated, then not only are you increasing the amount of time that that person is not up to full productivity, so you're hitting your economy, but you risk the situation causing a permanent hit to their capacity because, you leave treatment for too long and you may not get them back up to full fitness or health. And Tories all too often fail to understand this, usually because they only measure productivity in terms of the number of people working, rather than by any actual measure of productivity. I suspect this is because they don't want to face up to the fact that the people they represent, the ones they lobby for, contribute almost nothing to our GDP, yet take a great deal from the parts. All Sunak could say in response was to talk about, what about the Welsh NHS? Now, the Tories have been trying to suggest that the Welsh Labour government is getting poorer outcomes than the Tory-run English NHS. Only it's a little bit smoke and mirrors because the Welsh NHS were even covering for gaps in Cornwall's provision recently. I mean, if they're really struggling themselves, everywhere's struggling, don't get me wrong, but if they were especially struggling, how would they be able to help the English NHS cover? Anyway, Starmer then decided to use Wales himself to illustrate a point. He said, well, more than double the entire population of Wales are now on a waiting list for England. In reality, it's much more than double. He then repeated a bit of a habit that he has at times, which is a good one. He asked Sunak a question he knew he would not answer, so he could give the answer himself. So he asked how many people were waiting for mental health treatment. Sunak, of course, did not answer, choosing to blame Labour for not blaming doctors for this. So he's gone from blaming doctors to now blaming Labour for not blaming doctors. It's all someone else's fault. So Starmer dutifully answered that actually it's 1.2 million waiting for mental health treatment. Now, I'm going to make another point here. The number will be much higher. I've got personal experience of knowing quite a lot of people who have needed mental health treatment and have not even bothered to try accessing it on the NHS because they know there's no point. The capacity isn't even close to being there. Like, you can have a physical injury or illness and you might have a long wait for treatment, but there's a wait, you'll be put on a waiting list for treatment. For mental health, and the experience of many people I've known, is that you don't even get put on a list. They just throw you some antidepressants and tell you to go away. So the actual number in need will be much higher. But Starmer quoted the official figure and asked Sunak if he would accept that for family or friends. And Sunak just said that he was expanding patient choice. Again, utter irrelevance. Patients don't want choice. We want treatment. I remember some elective surgery I had about 5 years ago. The surgeon gave me a range of options. I had 3 choices. Do you know what I said? I asked him which was best and he told me. I said, well, we'll go with that then. I'm not going to choose. Do I look like a surgeon? What the bloody hell am I going to do with choice? Don't give me choices. Give me the treatment with the highest probability of good outcomes. And who's going to know what that is? The consultant surgeon. Starmer then used another line that has been fruitful against both Sunak and Johnson. He said that Sunak was taking no responsibility for the state of the NHS, which is absolutely evident, like I've just said. He blames the doctors, then he blames Labour for not blaming the doctors. It's madness. Keeps blaming medical staff. Starmer asked Sunak how a family waiting for treatment would feel that Sunak's boasting that everything's fine. Again, no response, other than to say, well, the government's doing all it can. Now, Johnson did this a lot. Sunak's doing it a bit. There are certain stock responses I would like to see Starmer hammer home. The issue with PMQs is quite a lot of the time what you say doesn't really feed through to the public. Every now and then there's like a big moment, and there was a bit of a moment today. You need to hammer it home. Like, whenever a Tory minister, especially the Prime Minister, says that they're doing their best, when their best is clearly not good enough, say so. If this is your best, then you are a failure and you should call a general election now so that a government whose best will be good enough can take over. I would advise Starmer to use some variation of that line as often as possible. Keep repeating it. Do it as often as you can. And it'll become a catchphrase. That then will have cut through to the public. Finally, a couple of other things I want to mention. Stephen Flynn of the SNP used his questions to ask about Gaza again. They see this as a potential wedge issue. They're losing a lot of votes to Labour. They've got a Holyrood minister embroiled in scandal, which wasn't entirely helped by Yusuf backing him to a fairly unwise degree. However, we now have a ceasefire. We're not calling it that. Starmer's calling it the humanitarian pause, but it's a ceasefire, dictionary definition ceasefire. You would think that Flynn would be delighted. Oh no, apparently not. He said that MPs should back a permanent ceasefire, but this is an oxymoron. A ceasefire is temporary. Sometimes, if you're lucky, the last ceasefire of any war will lead to a permanent peace, but that's not a permanent ceasefire. A ceasefire only exists in a state of war. For there to be a ceasefire, there has to be a war. If the war's over, there's no ceasefire anymore. If what Flynn wants is a permanent end to fighting, it's curious he didn't support Labour's motion last week, because that's specifically what it called for. Explicitly what it called for. And don't at me, this is a political game that the SNP are playing with people's lives. They argued for a position last week. They've got it. Are they happy? No. Now they're arguing for what Starmer proposed last week and they refuse to support. And they're still somehow trying to beat him up over it. As I'll keep repeating, the UK has no power to do anything. All we have to make a difference is diplomacy. And there are things that work in diplomacy and the things that don't. Demanding doesn't really work. Diplomacy has yielded this ceasefire. It's not enough, because a ceasefire never is enough, because it is a continued state of war. And it is never the demand of anyone serious about peace, only a stepping stone. Finally, the big drama, James cleverly dropped a bollock again. A Labour MP asked Sunak why the child poverty rate in his constituency was 34%, and cleverly could be heard audibly saying, because it's a shithole. You don't even have to lip read for this one. You could hear it. I'll put a link below, of course. Because it's a shithole, he said. Now, if that is the level of diplomatic acumen that our former Foreign Secretary had, then we can think ourselves extremely lucky he didn't actually make any unstable parts of the world much worse. Yes, I know the Middle East flared up while he was Foreign Secretary, but I don't think that was his fault. But there we are. Those are my thoughts. Let me know yours in the comments below. I hope you found the video interesting. If you did, please click the like button. And if you'd like to support the channel further, the join button for memberships. And until next time, I'll see you later.